We shall discuss a topic which has been creating quite a few queries in the mind of the public. We shall discuss about the clinical presentations of brain tumors. Brain tumors is simply nothing but growth within the skull or the brain. We should understand that the clinical symptoms of brain tumors is due to two main reasons, that is due to compression of the brain and due to irritation of the brain. What are the compressive symptoms? The most common compressive symptom is headache. Please don't confuse the normal or the usual headaches we all experience in our day-to-day life, such as stress headaches and migraines. The brain tumor headaches is peculiar in that it occurs in later part of our life and gradually increases in its intensity. It's also usually occurs in early morning, that is the patient wakes up with sudden excruciating pain from sleep. It can also be associated with projectile vomiting, that is vomiting which is not preceded by nausea. It comes all of a sudden, that is projectile vomiting. Then the other compressive symptom is focal neurological deficits. We all know the brain has different areas and each areas have different functions. So when a particular lesion or any tumor grows in a particular area, that particular function gets affected. For example, if it is on the left side controls the right side of our body. So when that area get involved, we can have symptoms on the right side like it can initially start as tingling sensations, some paresthesias. We can even have some mild weakness and it can even progress to frank weakness. Similarly, if it is affect the speech area is located on the left side of the brain in the lower part. So when that areas get involved, the patient or the victim can have problems of speech or articulation. Similarly, if it involves the front part of the brain, that is the area which controls our social behavior, patient can present with behavioral abnormalities. Similarly, when the memory area is involved, patient can have memory problems, or when the lesion problem involves the balance area or the area controlling our gait, patient have difficulty in walking or problems with maintaining balance. These are the compressive symptoms. Similarly, we have the irritative symptoms which occurs due to irritation of the brain. The most significant irritative symptom is seizures. There are various types of seizures. Can be focal seizures which involves part of our body, can involve a part of the face, or it can involve any part of our hands or legs. Then we have generalized seizures where it involves the whole body and our body is thrown into a bout of fits, and in this condition we can even have loss of consciousness. There are other types of fits like a psychomotor seizures, then myoclonic seizures. So what we should understand is that when these symptoms occur in later part of life and gradually increases in intensity over time, we should make sure it is taken seriously and investigated properly.